There's lots of progress, I think, at the moment in terms of developing drugs for dementia, and there are many different approaches. So as I've said, our approach is to look at proteostasis, so changing levels of the proteins. But there are other strategies, so people are looking at the effect that those proteins have on neurons and on other cell types. And that's work that's going on at our sister institutes at UCL and Oxford. We're also really interested in how the cells respond to these misfolded proteins, and there's a process called the unfolded protein response, and we're interested to see if we can turn that off in selected situations and see if that could have an effect on the progression of the kind of hallmarks of the disease in cells and in animals. If we look back over the last 10 years, I would say that the main focus has been on treatments that focus on amyloid. So we've had things like BACE inhibitors and beta amyloid targeting antibodies. I think the change is going to be that we will continue to investigate those in the clinic, but we're going to see new classes of molecules coming through. So probably approaches targeting tau in terms of Alzheimer's disease will be one of the next things that we increasingly see. But I think if you look at what's going on in basic research, people are looking at the roles of things like astrocytes and microglia and neuroinflammation. And I would expect over the coming 10 years that we'll start to see therapies looking at some of these other mechanisms. And it's quite possible in the end that we'll need a treatment that combines more than one mechanism or more than one approach given in tandem.